So today's topic is nutritional and food requirements for infants. Those who have the textbook, please mention the page number in the chat box. It's from your dietetics textbook. So it's page number 57, I guess. Those who have the dietetics textbook. So if anyone is joining late, please help them out with the page number or chapter name, topic name. So when we talk about infants until the from after first month, okay, their newborn baby neonatal period is till 29 days. From birth till 29 days is the neonatal time period. After that, infancy starts. Okay, second month of life up till the age of 1. Okay, up till the first birthday, it's infancy. Okay, first birthday till the third birthday, it's toddlerhood. These are different stages in the child's life. Okay, so during infancy, okay, infancy can be divided into two phases. The first phase is of exclusive breastfeeding, the first 6 months of life. The remaining 6 months is when the weaning diet has to be introduced. Okay, so today's topic we will talk around breastfeeding, okay, and weaning diet. So growth and development during infancy, you will see the most rapid growth here because in terms of weight gain. Okay, whatever the child's weight was when the child was born, okay, on that day, whatever the weight was, by the age of 6 months, the child has to double the weight. Okay, so a lot of weight gain should have a priority during infancy. Okay, a healthy newborn baby weighs around approximately around 3 kg. Okay, 2.5 to 3.9 kg, that is the healthy weight range. 3.2 being the average. Okay, so healthy newborn baby is approximately around 3 kg in weight, which should double by 6 months. Okay, so the child should have more than 6 kg of weight by sixth month. Okay, and then by the first birthday, when the child celebrates its first birthday, the weight has to triple. Okay, by the first year of life. So that much is the growth and development that takes place within in infancy. Okay, it's extreme growth and development, it's usually in terms of weight gain. Okay, other childhood milestones, infancy milestones also have to be reached. Okay, you can see on the slide, by the third month the child should be able to hold head up by itself. Okay, by fourth or fifth month, they are able to roll over on both the sides, left and right side. If you lay the child straight on a mattress, the child should be able to, or a floor, the child should be able to roll over. Then 5 to 7 months, they rise up on their own hands. Okay, like in a bhujangasana, they are able to hold themselves upright just by the strength of their hands. Sixth and eighth month, they will start to crawl. After the 6 months, up till the eighth month, also some children will sit without support. During the crawling phase itself, they will be able to sit without any support. Ninth to 10th month onwards, they will stand with support and slowly they will start walking. By the first birthday, the child should be walking. Okay, so that these all are the childhood milestones. So coming to the nutritional requirement, energy is around 92 kilocalories per kg body weight. Okay, whatever the child's body weight is, based on that 92 kilocalories on a daily basis, they per kg on a daily basis they should get from breast milk for the first 6 months. which the breast milk usually is able to provide that level of energy. Protein 1.16 gram per kg body weight. That also from the breast milk, it is adequate. There is no additional requirement for protein. Whatever the breast milk is able to provide, that is more than enough. But the requirement is around 1.16 gram. Okay, and here we are looking for rapid growth and development. That's why protein requirements are high in infants. Fat and essential fatty acids, 9 gram per day of visible fats. After the weaning diet has started, 19 gram per day of visible fats can be added. Initially, you don't have to worry about the fat content at all. Okay. After 6 months, when the weaning starts, 19 gram per day of visible fats at least has to be added to their diet. Calcium and phosphorus, 500 mg of calcium, 750 mg of phosphorus. Later it changes. Okay. Initially during the infancy, children will require phosphorus more than calcium. Then it changes. Then calcium requirement is more than phosphorus. If you check the ICMR data, if you have the table, just cross check. Is it still 500 mg of calcium, or did they change it? Iron 46 microgram per kg body weight. The first 6 months, the child will not get iron because when the child is born, there is specific iron in their specific amount of iron present in their liver. That is satisfactory for the first 6 months of life. After that, when you introduce weaning diet, it should be with iron-rich food. Sodium, zinc, iodine, breast milk is sufficient for that. Vitamin A, 350 microgram, again, breast milk is sufficient for that. Later on, you can, when you start the weaning diet, fruit purees, okay, carrots which are steamed and mashed can be provided. Egg yolks can be given. Okay, these all are rich in vitamin A. Vitamin D, breast milk. Okay, and in weaning diet, once you start weaning diet, add more ghee in their diet. Okay. Vitamin K injection is given. As soon as the child is born, vitamin K injection is given at birth. Okay, so that it can help producing blood clotting factors. Vitamin B complex. If the mother's diet is low in vitamin B, breast milk will also be low on vitamin B. So mother has to take care of her diet. Okay, during breastfeeding, mothers has to take care of vitamin B concentration in their diet so that their breast milk is not deficient in vitamin B. Okay, the amount of vitamin B in breast milk is directly dependent on mother's diet. Okay. Vitamin C as well. Breast milk is not a good source of vitamin C. Okay. From fresh fruits, fruit juices has to be added in the child's diet, in the weaning diet. Then nutritional assessment is done. For example, one example is taking mid upper arm circumference. Okay, that is one way. Taking the head circumference, chest circumference, checking the length of the child. Okay, and putting all these measurements on road to growth map. Okay, there is a growth mapping done for children up till the age of 5. Okay, so in that each and every month, whenever the child is taken to PHC, okay, even in Anganwadi, when the child joins Anganwadi, from there also they will continue taking the assessment of the height, weight, head circumference. Head circumference is only done during infancy, not later. Okay, length of the child, and the child is not able to stand upright until that age. Length of the child, head circumference, mid upper arm circumference. Okay, these measurements are checked on a regular basis to rule out any malnutrition or stunting, etc. So that's about the nutritional requirements. Is it clear to all so far? So coming to breastfeeding. Breastfeeding is a unequal way of providing ideal food for the healthy growth and development of infants. Breastfeeding is also an integral part of the reproductive process with important implications on the health of mothers, which means when you when you are exclusively breastfeeding your child, it kind of is a natural contraception for the mothers. Okay, breastfeeding suppresses ovulation. Okay, when the mothers are exclusively breastfeeding their child, it is suppressing their ovulation. Okay, so even if they indulge in unprotected intercourse, that would not lead to another pregnancy, because now the mother has to focus on the child that is born to her. Okay, at least the child has to cross second birthday. Okay, because it takes at least 2 years for the mother's body to heal from the physiological changes of pregnancy and to be back to normal. Okay, 9 months of pregnancy, child's first birthday, child's second birthday. Okay, this much time period is required for the mother to heal from the physiological changes of the previous pregnancy that happened. Okay, so when you are exclusively breastfeeding for that 6 months, definitely ovulation will be suppressed, so the mothers will not get pregnant again. Okay, so that's kind of a natural contraceptive. Okay, the as long as you continue to breastfeed your child well, it kind of gives the mother natural contraception. Okay, so within half an hour of normal delivery, breastfeeding has to be initiated. Okay, and if it was a C-section, okay, if it was a cesarean delivery, within 4 hours has to be breastfeeding has to start, even if the mother is unconscious. Okay, if even if the mother is under sedation, she's unconscious, breastfeeding has to start. Okay, and as much as possible avoid prelactal food. Some cultures, they have this practice. Okay, as soon as the family receives the newborn baby from the labor room, okay, they will put some honey in their mouth, rose water, okay, or some holy water. It should not be done. Breast milk should be the first food that the child has. Okay, no prelactal food, how much ever holy it is, whatever is your cultural or religious belief, should not give it to the child, not even honey. Okay, no holy, not even a drop of water, because the child's intestine, okay, is ready, is designed, a newborn baby's intestine is designed to accept breast milk, nothing else. Okay, so if you are giving some prelactal food to the child as soon as it is born, you will be messing up its GI tract for the entire future. Okay, so avoid prelactal food. Okay, even sugar water, these kind of things, do not ever give to the child. Breast milk should be the first thing. That too, colostrum is the first form of breast milk that comes. Okay, that should be the first food of the child, nothing else. Okay, so never, even for the first 6 months of child's life, child does not require water. Breast milk is the food and water for the child. Okay, and also for some mothers, like it is seen that if you use some natural form of skincares and all, okay, which has turmeric, honey, okay, things that things that are food, and you use it as a natural skincare for the child, it is also harmful. Okay, because oil, you can definitely oil the child, there are specific oils available, that is not food oil. Okay, So, like oats lotion, oat milk lotion, or moisturizer, honey moisturizer, turmeric paste, antiseptic creams, or something. Okay, don't use it on the child's skin. Okay, when the child is going to get accustomed to any form of food, that should be after 6 months. Otherwise, you are putting your child, you are putting your child up for the risk of getting allergies. Okay, when the child is exposed to some new kind of food, and if it is through the mouth, that is after 6 months of age, the child will not have much allergies as compared to children who were exposed to food as skincare. Okay, food was applied on their skin or something, that leads to food based allergies in the future. Okay, so avoid that as well. So breastfeed even if the mother is sedated, that is during C-section or any complicated delivery. If the mother is not conscious, still the nurses, the midwives will put the baby on the mother's breast. Okay, and usually a healthy baby will go in search for the mother's nipple. Okay, a very healthy child who has a good sucking reflex. Okay, suckling reflex is also a form of reflex. When you put a small finger in the child's mouth, the child will vigorously try to suck onto it. Okay, so that is a reflex, and there is that suckling sound that comes when the child is sucking on the finger or on the nipples of the mother. Okay, when you put the child on the mother's chest, the child itself will try to go search for the breast nipple for food. Okay, so that's a healthy behavior in the child as well. Okay, that's what we call as a healthy baby. So even if the mother is sedated, okay, you have to put the child on the mother's chest, and the child has to be fed the mother's breast milk. Okay, also, modern science and technology has not been able to produce any better food for infants and newborns other than the mother's milk. Okay, so it is the best way of satisfying the child's nutritional and physiological requirements, and also psychological requirements. Breastfeeding is a bonding, when you are breastfeeding the child, it forms a bond between the mother and the baby. Okay, it improves the child's gut health, immune system. Okay, helps in brain development. There are so many um, advantages of breastfeeding that no other food can give. Okay, and it is always clean. You don't have to sterilize the food. It's naturally, it is coming from the mother's body. It is clean. Okay, then the different forms of milk. Colostrum is the milk that comes in the first few days. Okay, it is pale yellowish color, orangish yellowish in color. Then you have the transitional milk. Okay, it changes its color from yellow to white. Also, the contents change. Okay, then you have the mature milk. Mature milk, first you have the hand milk and the fore milk. Okay, fore milk is the first milk that comes, that satisfies the thirst of the child. And when the child is still continuing the breastfeeding, still drinking the milk, slowly the hind milk comes. Okay, that is one that is more rich in fat. Okay, so these are the different forms of milk. So colostrum, the onset is the first few days, that is within a week, colostrum secretion will stop. Okay, first 3 days is what the colostrum is secreted, and that is the immunity that you're giving to the child. Colostrum is rich in immunoglobulins. Okay, it is yellowish and creamy in color, high in protein, fat soluble vitamins, minerals, and immunoglobulins. So this is kind of a first vaccination the child gets. And also highly nutritious. It has anti-infective substances, rich in vitamin A. 10% of cholesterol could be protein. Okay, 10. That's so it is high in protein, and it has very less carbohydrates like lactose. Lactose is the carbohydrate found in milk. As compared to mature milk, cholesterol has very less carbohydrates. So when you feed the child with cholesterol, you are building up the stores of nutrients in the child and also building up the child's immunity. You're giving direct pre-prepared antibodies are given to the child. It will protect the child from some infectious diseases like diarrhea, which is very common in kids. So if you're delaying the initiation of breastfeeding, which is quite common in some parts of the country, you are depriving the child from this concentrated source of immunity. Okay. And the child's morbidity rate, mortality rate is affected. And in some communities in India, breastfeeding is started as late as the fifth day. Okay. Because of some superstitions and ignorance. And if the initiation of breastfeeding is late, the child gets a lot of infections, risk of infections. Okay. And instead of breastfeeding, if the child is given some pre-lacteal foods like glucose water, sugar water, honey, gouti, some animal or milk powder, these are harmful. Okay, that will lead to digestion issues. In transitional milk, approximately for 2 weeks after colostrum, transitional milk will be made. Okay, that is also some creamy in color, not yellow, not completely white. Okay, that is also high in fat. Lactose content increases in transitional milk. Water soluble vitamins are also present here. It gives the child more calories as compared to cholesterol. Then finally, mature milk will be secreted after 2 weeks of birth, and mature milk will be continued to be secreted as long as the mother is breastfeeding the child. Okay. So mature milk comes in two phases. When the child is being breastfed, the initial milk that comes, that is fore milk. It is whitish bluish in color because it has more water content. Okay, it can take care of the child's thirst. Okay, hint milk is more creamy. Okay, it will satisfy the child's hunger. So fore milk is early, it is low in fat, but high in lactose, sugar. It is more sweeter. Okay, protein, vitamins, minerals, and water. Hand milk is, it will come quite late, but it is rich in fat, calories with less sugar. Okay, but since it is rich in fat, it is more creamy. It can satiate the child's hunger. Okay, so these are the different stages of breast milk production. Is it clear to all? And breastfeeding should be given as often to the child as it desires. Okay, don't try to put your schedule to the child. When the child is crying for food, you have to feed the child. Okay, and it should continue as long as the child wants to suckle onto the breast. Okay. This is how colostrum looks like. Okay. In the first 3 days, colostrum is secreted. So this is how colostrum looks like. And then you can see the transitional milk. Okay, it is changing its color. It is getting lighter and lighter. Okay, so in the first 3 days, it is bright yellow in color, orangish yellow in color, because it is rich in antibodies. Then it is transitioning. Okay, for the next 2 weeks, the color change will start, and slowly after 2 weeks, it's the mature milk. Okay, second week onwards, then as long as the mother continues breastfeeding, it's the white creamy color, creamy milk. Child will not even require any supplements if the colostrum is given. Newborn babies are usually very active during the first half an hour after birth. Okay, and during this first half an hour and 1 hour, the child will be kept with mother, and usually the mother is taught how to breastfeed. Breastfeeding is started. Okay, and the child will learn to suckle on very fast within that first half hour after birth. And as much as possible, keep the newborn babies as close to the mothers, because that will ensure that the breastfeeding will continue. Breast milk production will also be sped up in mother. Okay, when the mother is seeing her child, okay, mother is getting the warmth of her child. She's able to touch the child, feel her child. Okay, at least look at her child. That will also, that maternal instincts will also start secreting breast milk. Okay, so don't separate the mother and child for long hours. As much as possible, the mother has to spend time with the child until and unless when she is resting, and if the child is crying. Okay, so that to make sure the mother rests well, you can keep the child a little bit far away. Okay, but otherwise, as much as possible, the child should be very proximal to the mother, so that breast milk production continues. There is no blockage in that. So advantages of breastfeeding: nutritional benefits that we know. It takes care of all the water soluble, fat soluble vitamins, macronutrients, fats, protein, carbohydrates. Okay, all the requirements of the newborn baby is sufficiently met by the mother's breast milk. Hormones and growth factors will also be transmitted to the child from the mother's breast milk. Immunological benefits, as we know, all immunoglobulin IgE, IgM, IgG, okay, these all immunoglobulins, these are antibodies, okay. Those are directly given to the child through breastfeeding. Psychological benefit, that is the bond between the mother and the child. Okay, the child will also feel safe and secure when around its mother. Okay, when there is a physical touch, a warm touch of the mother around the child. So that gives psychological benefits to the child. Okay, the positive relationship building between the mother and the child will also be initiated. Then economic, you don't have to prepare anything to give breast milk. It is readily available. Okay, it is sterile, it is clean. Okay, it is readily available whenever the child wants food. Okay, you don't have to carry anything. Okay, you don't have to carry any special utensils for preparation or anything like that. It's very economic. Okay, it reduces the risk of infant and child morbidity, that is disease rate in children. Exclusively breastfed children fall less ill as compared to children who are put on formula based diets. Then for the child's mental development, cognitive development, neural and brain development, because of the essential fatty acids, DHA, present in breast milk. Okay. When you are exclusively breastfeeding the child, it means nothing else, no other milk, food, or drinks, not even water should be given to the child, only breast milk for the first 6 months. And babies who are exclusively breastfed, they don't require any other additional food or fluid, any herbal water. These things are not required. Breast milk alone is adequate to meet all the hydration as well as the nutritional requirements for the children. And if you are giving some uh, formula feeds apart from breast milk, if you're giving that to the child, it suppresses lactation in mother as well, because the child will suck less on the nipple, and that will reduce the milk production and secretion. And also these kind of pre-lactal food and formula food that increases the risk of infection in children, usually GI infections, diarrhea. So far, is it clear to all? Formula milk is given only for children, some special cases in which children cannot digest lactose. Even breast milk has lactose. Okay, so in some children who are born with some metabolism errors, they cannot digest lactose. In such cases, formula feed is given. Okay, and environmental, you cannot cause any pollution in the environment because of breast milk. It's a natural food for the child. Okay, it will not cause any environmental harm. But when you go for formula food, when you're dependent on formula food, there is plastic, there is packaging, okay, a lot of waste, requirement of fuel, okay, for production, manufacturing, transportation, large scale industrial production. Okay, so it affects the environment. Breastfeeding will not have any effect on the environment. It is the most natural food for the newborns. Now, for the mothers, what are the advantages of breastfeeding for mothers? So, for mothers, immediate results of breastfeeding, uterine involution. What is uterine involution? When at the pre-pregnant state, uterus is around just 100 grams, okay, in weight. By the 10th month of pregnancy, 9th month of pregnancy, by the end of third trimester, uterus is almost 1 kg, okay. Now this 1 kg uterus has to go back to that 100 gram, approximately around, it will not go exactly to that 100 gram, it would be 120, 130 gram, okay, but at least a big jump should be there, okay, from 1 kg to just 100, 120 grams. So that is what we call as uterine involution, uterus going back to its pre-pregnant state. So with breastfeeding, when the mother is exclusively breastfeeding the child, the uterine involution process speeds up, okay, because oxytocin is secreted, okay, during breastfeeding, and this has some hormonal effect on uterus that it will go back to its normal size. Reduced bleeding, okay, the postpartum bleeding that happens, that also reduces slowly over time. Reduced risk of infections for mother. Lactational amenorrhea, that is, when you are exclusively breastfeeding the child, you will not have menstruation. Okay, mothers will not have menstruation for that 6 months because ovulation is suppressed. Okay, that's a natural contraceptive that mothers have when they are lactating. Okay, then reduced adiposity and weight. Whatever weight gain has happened during pregnancy, that will go back. Okay, that will reduce. Reduced risk of postpartum depression as well in mothers, reduced stress and anxiety, improved body image because body is trying to go back to normal, okay, as much as possible. So these are the immediate effects of breastfeeding for mother. Long-term benefits. Breast cancer is reduced. Risk of breast cancer is less. Risk for ovarian or endometrial cancer, endometriosis. These all are female reproductive disorders. Okay, endometriosis, diabetes, osteoporosis, blood pressure, cardiovascular diseases, arthritis, Alzheimer's, multiple sclerosis. So the risk of all these diseases are less in mothers who choose breastfeeding. Okay. Then coming to breastfeeding for illness. But before that, even as nutritionist and dietitian, you can also counsel expectant mothers regarding breastfeeding, the advantages of breastfeeding. Okay. Especially for mothers whose it is the first child, okay, who are pregnant for the first time. Primary mothers, primiparas. Okay, primipara means first pregnancy. Okay. So expectant mothers who are pregnant for the first time, those are the main targets who should get the counseling regarding the advantages of breastfeeding. And whenever the mothers come for this antenatal checkups and that TT immunization during pregnancy, mothers have to take the TT vaccine. Okay, so when they come for the TT immunization and antenatal checkups, these are the best time to give counseling regarding the importance of breastfeeding. What diet they should have, iron tablets, folic acid tablets, rest, okay, not using prelactial food. So these kind of health education has to be given. So coming to breastfeeding during illness, before that, the frequency of breastfeeding, infants should be breastfed at least 5 to 6 times a day, at least whenever they ask for it, they have to receive the breastfeeding. So breastfeeding during illness when the mother is sick, it is possible. Okay, if the mother is taking medications, if she is taking the treatment, okay, she can breastfeed the child. Okay, only discontinue breastfeeding if your physician, if the doctor has said you not to, because certain medications can cross over, okay, and it can reach to your child through the breast milk. In such cases, you have to discontinue breastfeeding during that time. Or if at night you are taking the medication, in the morning you have to expel the breast milk. Okay, the first round of breast milk, expel it, and then the second round of breast milk you can give. Okay, so doctors usually give these guidelines when at what time you have to take the medication, which time you have to expel the breast milk, okay, and when you can give continue the breast milk. These kind of um, management knowledge is given to the mothers when they are on some specific medications. So in case of AIDS, if the mother is suffering from AIDS,
There is a risk of mother to child transmission through breastfeeding as well. Okay, so that's a unique challenge. So when you are promoting breastfeeding, but the mother is having HIV or she's an AIDS patient, there is around 10 to 20% risk of AIDS being transmitted to the child through breastfeeding. All HIV infected mothers should receive the counseling of the importance of breastfeeding, okay, and the importance of using the services of human milk bank, okay. Even if the mother is HIV positive, her nutritional requirements should be met. And the advantages of breastfeeding usually surpasses some risk of HIV transmission. Okay, so that has to be explained to the HIV positive mothers. So do not mix the feeding for children who are born to HIV infected mothers, which means breastfeeding along with formula diet. Don't do that. Okay. If the mothers are choosing to artificially feed the child, okay, only continue artificial feeding, formula feeding. If the mothers have chose to breastfeed the child, only continue that. But don't do the mix of both these two, because the nutritional, the artificial feed, it has the the shape of it when it enters the gut. It can cause some micro tears in the child's gut. Artificial feed. And on top of that, if the child is having breast milk, okay, and if there is virus in the breast milk, it will automatically enter the child's blood stream through that minor cuts caused by artificial feed. So that's why don't mix the feed. If you have chosen artificial feed, continue only that for HIV positive mothers. If they have started breast milk, okay, breast milk will not cause any cuts or tears in the child's GI tract. Okay, so even if the virus is entering the GI tract, the child's immunity can manage it. Okay, the hydrochloric acid and the other immunity in the child's body can is capable of managing it, so that because the virus has not entered the child's bloodstream. Okay, GI tract should not have any cuts and nicks, so the virus will not enter the bloodstream. Okay, so these kind of counseling has to be given to the HIV positive mothers. And all the breastfeeding mothers who are HIV, you should support them to continue exclusive breastfeeding for the 6 months and don't mix with artificial feeds. But if they choose artificial feeds, let them choose it. Create a safe environment for them to continue artificial feeding for the child. During birth also there is a chance. During birth there is a chance of transmission. If it is vaginal birth, the risk is less, but if it is C-section, the risk is slightly high. Okay. Mothers will be taking ART medications. Okay. Even during pregnancy, pregnant mothers, there is a specific form of ART, not the regular triple therapy. ART has a triple therapy. Okay. 3 types of antiretroviral drugs are given for normal humans, but during pregnancy, there is another combination that is given. Okay, so definitely pregnant mothers can continue ART therapy. Lactating mothers have another combination. Okay, the combination changes based on the physiology of the woman. And also, breast milk is the most easily digestible and best pacifier. Pacifier means when the child is crying, when the child is able to suck the milk when it is showing tantrums or when it is crying, it pacifies the child. It calms down the child. It meets all the child's nutritional demands as well as immunity demands. After 6 months, you can mix it. Okay. After 6 months of exclusive breastfeeding, formula feed can also be given. Okay. But until 6 months, you have to make sure that the child's GI tract, okay, it is used to only one kind of food. Okay. Is it clear so far? Then you have the Infant Milk Substitute Act of 1992. So this act was established to prevent the marketing and advertisements of artificial feed. You will notice, you must have not seen advertisements of any formula feeds on TV or any big board or signs that advertises some infant milk substitutes, bottle feeding, okay, other milk, breast milk substitutes, formula feeds. You will never see the advertisement for these. Okay, not even in hospitals. It's not allowed. Okay, because this regulation, this is the reason why. In USA, they in between they had advertised a lot regarding formula feeds when it was released. Okay, and that substantially reduced the number of women breastfeeding their child. Okay, and later the impact of formula feed on the child's health was discovered, but it was too late. So we could learn from that. Okay, so this act is to amend the infant milk substitutes, feeding bottles, infant foods. Okay, how you are producing it, not just for advertisement. Okay, at the production level, what kind of ingredients are you using for infants, for these formulas? Okay, from where are you getting your supplies? Okay, how are you distributing this? How are you storing it in the industry where it is produced? Okay, how are the feeding bottles made? The quality standards, okay, are very important. The government is very strict about these companies. Okay, this is to protect and promote breastfeeding and ensure proper use of infant foods only when it is required, only in situations where the child cannot tolerate breast milk or the child does not have access to breast milk. Only in such situation, these infant foods should be used. Okay. In 2003, this amendment was done, which means it was reenacted. Okay, and this also prohibits, from 2003 onwards, you can't even distribute pamphlets. Okay, pamphlets, printouts, flyers. Okay, you cannot even promote the milk substitutes in hospitals to a gynecologist or an obstetrician. You cannot promote these brands at all. Okay, so that's the Infant Milk Substitute Act. In case of low milk production, usually the mothers are producing enough milk. Okay, the initial few days, the child requires few mls of milk, just 10 ml, 20 ml, like that. The child's stomach is that small. Okay, the child's stomach is not even the size of a full ripe tomato. So you can imagine how small would be a newborn baby's stomach. So what would be the capacity? Just 10 ml, 15 ml, that's it. Okay, that much milk is required for newborn babies. Slowly, when they grow, the stomach size increases, and when you're continuing the breastfeeding, the breast production also increases along with the child's growing body. Okay, so it matches. So, low milk production, usually mothers think that they produce less milk, but they are producing adequate for what their child requires. But in certain situations, okay, there are uh, some other external factors that could cause decreased milk supply. If the mother is not taking care of her health, she is malnourished. She consumes lot of caffeine. Okay, she smokes a lot, or she is taking certain medications which suppresses lactation. If you go and check the nutritional requirements of lactating mothers, we have discussed those chapter last week. Okay, we have discussed certain medications also that suppresses lactation. Like if you are having migraine, the medications that you take for migraine, chemotherapy, okay, some antibiotics, these can suppress lactation. If the mother is stressed out or she's undergoing postpartum depression can also suppress the milk production. And if you're not taking good diet, smoking, okay, some substance abuse, this can cause decrease in breast milk supply. Okay. And sometimes when the mother does not have the confidence to breastfeed, okay, she may feel too shy. It's psychological. Okay, she may feel too shy to take out her breast, expose the breast, and feed the child. Even if she's alone, okay, she may feel too shy for that. That could also suppress the breast milk production. Is it clear to all so far? Then breast milk bank, human milk bank. So this concept started uh, in Mumbai in India, first in Sion in Mumbai, India, and later it has been it spread widely. Okay. Um, so this the concept of human milk bank is women who are producing a lot of milk. Okay, they can also collect their milk in specific containers and donate it to breast milk bank, human milk bank. Okay, where other children can use the milk. Children who have lost their mothers during childbirth. Okay, children, mothers who are undergoing certain issues like breast cancer. Okay, and she has given birth to a child. Okay, so in such cases, or if the mother is undergoing some cancer therapy, chemotherapy, then her breast milk cannot be given to the child. Okay, so even some screening is also done in the human breast milk bank. Okay, they screen the samples, they test it. Okay, they store the donor milk, and they usually collect it from healthy lactating mothers. The main objective here is to make sure that every child receives human milk as early as possible, especially for the children who are born weak or preterm babies. Okay, when the children are born before term, when the mother is not capable of producing milk yet, but the preterm babies also require milk. Okay, breast milk. So in serving them also, milk bank can provide supply milk for preterm babies. In India, there is another name for it, that is Comprehensive Lactation Management Centers. Okay, CLMC. This is what we call it. So there are certain storage guidelines as well, okay, which you can use at home also. So if you are freezing the milk, it has to be frozen at minus 18 degrees Celsius, okay, until it is ready to use. Every batch of human milk that has been collected will have its expiration date as well, okay. Once you thaw the milk, thaw means it is cold milk that you get out of the freezer and fridge, okay. You have to thaw it, bring it back to room temperature, slightly lukewarm, okay. And milk should be kept in refrigerator. After thawing, it should be kept in refrigerator at just 4 degrees Celsius or below that. Don't freeze it. And within 24 hours, you have to use it. Once you have thawed the milk, you have to use it within 24 hours. Okay, that is frozen milk. You have brought it back to room temperature, slightly lukewarm. You have to use it up within 24 hours. So artificial feeding, in what situations artificial feeding is chosen, okay. If the child is born with lactose intolerance, congenital lactose intolerance, usually people become lactose intolerant in the later stage of life, okay, because newborn babies, they definitely produce lactase enzyme. The lactase enzyme can break down lactose, okay, but some children, they cannot produce lactase since birth. So that is a situation called congenital lactose intolerance. So breast milk also has lactose. The initial few days they can have that colostrum, but after that they will show signs of diarrhea, okay, because colostrum is not that high in lactose. Transitional milk and mature milk, they are high in lactose, okay. Then children who have galactosemia. So galactosemia also, galactase, an enzyme that the child is not able to produce. So galactose, undigested lactose, will be in the blood for very long time. Okay, and high amounts of galactose will stay in the blood for a long time. That is what we call as galactosemia. So here also artificial feeding will be required. Okay, lactose-free feeding will be required. Okay, and if the mother is taking these medications, okay, if she's on chemotherapy, anti-cancer drugs, if she's taking anti-thyroid drugs, okay, because thyroid drugs can also that iodine can and thyroxine can pass through the breast milk and it can alter the child's thyroid functioning as well. Okay, so mothers who are on anti-thyroid drugs, if she's taking lithium, that's an antipsychotic. Okay, ergo derivatives, that is for migraines. Okay, if she's taking medications for migraine, and iodinated radio contrast for thyroid issues, nuclear medicine. Okay, so in such cases, artificial feeding is chosen because you don't want these medications to pass through the breast milk and alter the child's physiology as well. Okay, if the mother has HIV, and artificial feeding is recommended. Okay, if the mother chose artificial feeding, HIV mother chose artificial feeding, then only artificial feeding has to be continued. Okay, breast milk will not be given to the child. Mother's breast milk will not be given to the child. Okay. Coming to low birth weight babies, LBW is low birth weight. Okay, very common situation in India. So there is a classification for low birth weight. Children who have uh, who are born with less than 2.5 kg. Okay, at birth, if the child is weighing less than 2.5 kg, it's a low birth weight baby. Okay. If the child is less than 1.5 kg, it's an extremely low birth weight baby. Okay, sorry, very low birth weight baby. And if the child is weighing less than 1 kg, it's extremely low birth weight baby. These are the classification of low birth weight depending on the severity of it. Okay. Usually preterm babies also come under this category. Okay. Malnourished mothers usually give birth to low birth weight babies. And the rate of low birth weight births in India is quite high. So ICU, all the low birth weight babies are given treatment in ICU. Okay. Pallida feeding is given because low birth weight babies usually they have not developed the sucking reflex. Okay. So that's why pallida feeding is given. Okay. Pallida is kind of a spoon which has a beak shape. Okay. Spoon which has a beak kind of a shape. And through that, expelled breast milk can be given to the child. Okay. And some children who cannot even open their mouth, cannot swallow. Okay. If the child does not have sucking reflex as well as swallowing reflex, pallida feeding will not work. You have to give NG tube feeding. Okay. So these are all clinical management. Okay. As a nutritionist and dietitian, you cannot manage a low birth weight. It's a clinical case. Okay. Especially an ICU case. An ICU case. Okay. So pallida feeding is given to the child. If swallowing reflex is not there, the child will be put in under nasogastric tube feeding. Okay. The child will be put in radiant warmer because it will keep the child warm. They require warmth. Okay. Incubator care is also given to the child. So there are a lot of clinical management that has to be done so that to ensure that the child survives. Okay. So that's about low birth weight. You don't have to learn about low birth weight in detail. Just be aware of the classification of it based on its severity. Okay. And lot many reflexes, normal reflexes seen in a newborn baby is absent in a low birth weight baby. By the time they catch up, okay, they gain weight, they grow and they catch up. These reflexes may or may not come, but it's usually many reflexes are absent. And based on that, clinical treatment is determined. What kind of treatment has to be given? Okay, nutritional as well as medical. And when do you consider a baby as a preterm baby or premature baby? If any child is born before 37 weeks of pregnancy, it's called preterm baby. Okay. If the child is born before 28 weeks of pregnancy, they are considered extremely preterm. Okay, that also has a classification. 28 to 32 weeks, very preterm baby. Okay, and 33 to 37 weeks, it is a preterm baby. Okay, so these are the classification of preterm. Low birth weight is also an issue here. Okay, but preterm babies are able to quickly catch up. Okay, preterm babies are able to quickly catch up as compared to their peers. Okay, in terms of height and weight. If nutrition is adequate, preterm babies can gain weight quickly, rapidly, and they have a good growth catch up. Coming to feeding problems in infants, tooth decay. If the child is not breastfed properly, they may not have adequate amount of calcium in their body. It must have not caused enough bone mineralization. Okay. And even if during pregnancy, if the mother was not consuming enough calcium, okay, that could also lead to tooth decay, milk teeth decay, as well as the permanent teeth decay. Both can happen based on the calcium consumption and not breastfeeding the child. Underfeeding, the mothers may presume that the child is full. No, it's not longer required. So they keep a huge gap between two feeds. Okay, so that could lead to underfeeding and malnourishment issues. Diarrhea, it's usually overindulgence with artificial feeds and formula feeds, usually will give diarrhea. And diarrhea is very common among newborn babies. Okay. And when you are during the weaning stage, if you are introducing some new food, if the child is not able to digest it properly, it usually results in diarrhea. So that is very common. So hydration levels in children has to be taken care of. If diarrhea is common, hydration levels has to be taken care of. The child should not get dehydrated. Next is constipation. If the child is not getting adequate amount of feed, okay, or if the water content in the breast milk is low because if the mother is dehydrated, that could lead to constipation in children. Then colic is a case in which the child cries a lot. It's usually because of some gastritis. Okay, child is crying because of gastritis or gastric issues. Okay, and child is usually very distressed. A colic child is very distressed. Okay, they cry a lot. And usually when the child is about 3 weeks old, the colic scenario will start, and it will get worse as the child grows. Okay, cries a lot, not crying, sleeping properly. So that's what we call as a colicky baby. So you have to always keep moving. Okay, use a pacifier, wrap the child properly, let your baby cry for a little while, and they will sleep automatically. They get tired and sleep automatically. And also because of gastroenteritis, child can have colic cries as well until it is passed. Once the gas passes, the child is back to normal. Next, coming to weaning. So weaning is a process during which infant changes from full dependence on breast milk to a complex independence from it. Okay. Till the age of 6 months, the child was completely dependent on breast milk for nutrition. After that, the child is not completely dependent on it. Okay. The child will still require breast milk or any other forms of milk. Okay. But will require other additional nutrition, other variety in food as well. So that is what we call as weaning, when the child is transitioning from exclusive breastfeeding to weaning diet. So usually, uh, the first food for the baby in 4 to 6 months in India, usually by fifth month weaning is started. Okay, because that Annaprasanna, the ceremony, okay, it is followed using Hindu calendars. Okay, Hindu calendars have less days as compared to the Georgian calendar which we follow. So by 4.5, 5 months, the child is considered 6 months of age. Okay, there is a specific time period by when Annaprasanna has to be done for children. So it is usually before 6 months. Okay, so usually single ingredient food is used. Do not mix a lot of food, or do not mix the purees of different vegetables. One vegetable, steam it, puree it, and give it. Fruits also, just take one fruit, puree it and give it. Okay. Dal rice combination can be given, but if you are using other millets, just use one type of grain here. Single ingredient food has to be used here. It's usually the staple food of the family that is considered as the first food. Okay. Porridges are made. It could be suji, broken wheat, atta, ragi, ground rice. Okay. These millets can be used, whatever is the staple food of the parents or the family. Roasted flour of any cereal can also be used. Roast the cereal, grind it and with water. Avoid sugar till the first 9 months. Okay, so sugar and salt, because the child's tongue has high number of taste buds. Okay. Jaggery can be added because it has high energy value as well as other minerals. When you start with these porridges, the first meal, first food, it should be on a thinner side. And when the child grows a little bit, consistency can change from thin to thick. And in some cases, if millets are not the staple food, if even if you take uh, chapati, half chapati, soak it in milk, okay, mash it properly and feed it to the child by adding little bit of ghee, a tiny bit of jaggery into it, that is also nutritious. Soak and mash chapatis, like the soaked chapatis in milk. Okay, mash it properly and let it go through a sieve. So then you get smooth paste of it. Okay, without any grime. So the child will not choke on anything. Fruits like banana, papaya, chiku, mango can be given at this age. Infant foods can also be given. Then by 6 to 8 month of age, biscuits may have slightly higher content of sugar. So you have to be careful with that, okay? 6 to 8 months, bite-sized foods, finger foods can be given. Eggs, khichdi, meat, pure porridges can be given. Cereal porridges, mixed food, or you can mix cereal pulse, vegetables, okay, like khichdi can be given to the child. Dalia can also be given. Suji, kheer, upma, idli, dhokla, bhat and any bhaji, okay, rice bhaji. These are the traditional foods with little modification because you have to make the food more suitable for the child. Okay. Like if you are giving idli with little oil and little bit of sugar. Okay. That is complementary and it will help the child also in growth. Khichdi, just don't give cereal and pulse only. Add 2, 3 vegetables while cooking. Okay. Then by 8 to 10th month, semi-solid food with texture can be given. Okay, different textured food. Till now you are giving everything that is kind of a semi-liquid. Okay, you're not giving any hard food so far. So now little bit of semi-solid food can be given which has that bite, because the child has now developed teeth. Okay, by 8th and 10th month, teeth has begun to come erupt. Okay, so fruits, vegetables, seafood, non-vegetarian food can also be started here as well. Okay, eggs can, you can start eggs beforehand, but it is suggested to start non-vegetarian food after 8 months. paneer, chicken, yogurt, mild amount of spices and juices can be given. And then by the first birthday, the child should eat whatever adults are also eating. Okay. Whatever is food is prepared for the adults, the same food can be given to children as well. Okay. With the food that require more chewing so that the jaw develops well. Okay. Pieces of fruit, vegetable, chapati with dal, sambar, soup, scrambled eggs. Okay. Whatever an adult can have, the same kind of food with mild amount of spices. You have to tone down the spice, sweetness, and salt as well. Instant infant food can also be given, like for example, uh, some sattu preparations are there. Okay. uh, any preparations of sattu. Okay. Or if you can take 3 parts of any cereal, millet, 1 part of pulse, and half part of groundnuts or white till. Okay. Like rice, wheat, ragi, bajra, jowar. That could be 1 part, any one of them. Another pulse, moong, chana, arhar dal. Okay, that would be second part, any one of them. And the third part could be either groundnuts or the white sesame seeds still. Okay. These can be roasted and ground, mixed properly, and stored in airtight container. Okay. And when it is time for for you to feed the child, take two tablespoons of this instant food mix, add boiled hot water or milk into it. Okay. Little bit of ghee, jaggery to taste. Okay. Mix it well and give it to the child. Okay. So this is an instant infant food that can be prepared at home, stored at home, easy to prepare as well. Okay. Protective foods like milk products, fish, iodized salt, all this should be added apart from breastfeeding. If you add 1 teaspoon of oil or ghee in every feed, that will take care of the fat requirement. Add jaggery, that will take care of the energy requirement. Give malted food. Malted food means first you have to sprout the cereals. Okay, it could be wheat, ragi, any cereal or pulse. You have to sprout it. Then you have to dry it in the sun. Okay, at least for 2 days, dry it in the sun. Then you have to grind it and store that powder. That is how you malt it. Okay, malt, when we talk about malt, it is not just random powder of any cereal or pulse. Okay, it's the sprouted cereals. You have sun dried it, then ground it. That is a malt. It's highly nutritious, protein rich, energy rich, and give thick porridges, not thin porridge. So is it clear to all? Coming to the problems of weaning, obesity, some children will just keep on eating, they will not stop, and parents may think they are still hungry. Okay, some children, they are not aware of the food or their stomach getting full. Okay, so they keep on eating and the parents will keep on feeding. That could lead to obesity. So you have to take care of that. Underweight, not feeding right quality and quantity of food at the right time. Okay. Food allergies are common. Usually the children can grow out of food allergies later on in their life. Okay, but you have to be aware of how the child reacts to a new food that you have introduced for the first time. Usually in that 6 to 8 month phase, you are introducing different kind of new food
on a regular basis, on a weekly basis. So you have to observe the child on the day when you have introduced a new kind of food, if there is any intolerance or allergic reaction. Lactose intolerance, if the child is lactose intolerant, lactose free food has to be given. Substitute cow's milk or buffalo milk with almond milk or oat milk, soy milk. Okay. Usually the child will have a lot of tantrum to take new food. Okay, you have to be patient. Today, if the child refuses the food, doesn't mean you should not try the food ever again. You have to keep trying, keep giving the child the same food, expose the child to that food again and again. At least 10 times you have to expose the child to the same food which the child refused initially. Okay, until one day the child will eat it. Okay, even after exposing the child to that food for 10 days, the child is still not having it, then take a break. Okay, after a month or so, reintroduce it. Taste buds have already developed, it is hyperactive. Okay, so that's why you have to reduce the amount of sugar and salt. Okay, the child's taste buds are hyperactive. Even they, what you consider as sweet, the child, for the child it is the sweetest. Okay, what you considered as little bit salty, it is the saltiest for the child. Okay, so they have too much of taste buds which are hypersensitive, hyperactive. Okay, so that's why avoid salt and sugar at least until 7 to 8 months. Feeding with hands has no issues. You hand wash. Okay, wash your hand before feeding the child. That's it. You can feed your child with hand or with spoon. Okay, it should be hygienic. That's it. Where you are, in what plate you are giving the food to the child. Okay, which spoon you are using. If you are using your hand should be washed properly. Keep your nails short. Mothers should keep their nails short. Okay, because while handling the child's tantrum, you may hurt the child as well. Okay. Choking, if you are giving big pieces to the child, if the child is not able to chew properly, or you have to also identify that is your child chewing the food properly. Some children, they just without chewing properly, they are in the hurry to swallow it. Okay, so the pieces of food that you give to the child should be small enough that it will not choke the child. Okay. Diarrhea, introducing new food will cause some or the other reaction. Diarrhea is very common. Okay. ORS you will always require. If a parent has, if a family has an infant at home, they will have ORS at home as well. Okay, it's common. So that's about nutritional requirements for infants. If you have any queries, you can mention in the chat